Good afternoon, Dr. Reed.
Afternoon.
I'm Robert Eckerd, and I represent Mr. Coker here. You indicated on direct exam that you interviewed, or you based your analysis on 6 hours of interview with Mr. Coker. Is that correct?
Yes,
In fact, isn't it true that the entire 6 hours that you based your evaluation on was interviews, including time with his teachers
yes,
and interviews with his parents
yes, and friends.
and friends? Anything else that you included that 6 hours with?
No,
How about depositions? You did read depositions, did you not?
yes, but that wasn't part of the 6 hours.
And you also,
Medical records as well.
medical records. So your report was based upon 6 hours of total time spent on all these matters, correct?
No, 6 hours of interview time.
Now, there's no dispute that Brian Coker suffers from depression, correct?
Correct.
And he also suffers from post-traumatic stress disorder.
I do not believe he suffers from post-traumatic stress disorder.
Hence, your report omits that completely, correct?
I believe, I state in my report that I don't think he suffers from it. He doesn't meet criteria for post-traumatic stress disorder.
Well, depression is a mental disorder, correct?
Yes, it is.
Did you review any blood profile of Mr. Coker?
In what way do you mean?
Any analysis of his blood? Was he on any MAO inhibitors or any other medications that you're aware of?
He wasn't on any medications that I was aware of.
That you're
We
aware
don't
of?
test for those in blood.
Were you aware of any other medical blood assay that you reviewed?
Just whatever was in his medical records.
So the answer to my question is no, correct?
Correct.
All right. Now, Mr. Coker took Zoloft for 4 weeks, correct?
For 3 weeks.
3 weeks, thank you. Correct?
Yes.
And you would agree with me that a person that is prescribed Zoloft should start feeling the effects from it, the positive effects from it, within 2 weeks, correct?
It could take up to 4 to 6 weeks.
That's not my question.
They will not necessarily feel positive effects within 2 weeks. It could take 4 to 6 weeks for them to feel it.
Do you understand my question?
Yes.
Okay. So the manufacturer of that drug would be wrong then? Is that your testimony?
I'm just saying it's not everybody.
And he took Paxil for 4 weeks, correct?
Yes.
The side effects for taking these medications, Zoloft and Paxil, include vomiting, correct?
Yes.
Diarrhea,
Yes.
sleeplessness,
Sometimes, yes.
nausea.
Yes.
Anything else?
And they could also cause sexual side effects.
And sexual side effects. You don't know if Mr. Coker experienced any of these side effects, do you?
No.
Your report doesn't indicate whether he did.
He didn't voice any to me, no.
Your report indicates that Mr. Coker has consistently refused taking medication treatment, correct?
Yes.
Well, in fact, he did take medication treatment, did he not?
He took it for a short period of time, yes.
All right. So your report is not accurate on that point, correct?
He refuses further medication, and he was not compliant with a medication regimen.
Well, I don't want to split hairs here, doctor, but you indicated he did not take any medical treatment, consistent medical treatment, when in fact we already established he took Paxil and Zoloft, correct?
Yes.
All right. So your report on that matter is incorrect.
No, he didn't give the medications enough time to work. He was not on a good regimen of medications. He didn't have an adequate treatment.
Well, that's not my question, doctor. Do you recall my question?
Yes,
What was my question?
if he received treatment.
If he consistently refused medical treatment with medications, and he did not do that, correct?
No, he did refuse treatment.
The use of Paxil and Zoloft, in your opinion, is a refusal?
He didn't take it adequately. He didn't give it enough time. And that is a refusal. That's considered non-compliance with treatment.
Now, in your report, you believe that electroconvulsive therapy would alleviate Mr. Coker's depression, correct?
It's one of the ways we use to treat this disorder, yes.
I didn't ask you the ways you treat it. I asked you whether, in fact, you stated in your report whether, and I'll call it ECT for short,
Correct.
whether ECT would alleviate Mr. Coker's
It's
depression.
one of the ways, yes, that it could alleviate.
Now, he didn't have this depression that you're aware of before the injury, correct?
No, he did not.
Now, ECT is also known as electric shock, correct?
Electroconvulsive therapy, yes.
Okay. And you would agree that it's used in only a minority of people suffering from depression, correct?
Yes,
And you would agree that the origin of ECT started in 1938 with the slaughter of pigs, correct?
I don't know actually.
And in
Exact
fact,
history.
it renders people unconscious, correct?
Before, now we give them medication so that they don't remember any of it,
So it renders them unconscious, correct?
based on the medications we give them. Not the actual ECT, the medications we give them do that.
And you do that to render them unconscious, do you not?
It's to decrease discomfort and to decrease side effects.
It's a yes or no question.
Well, it's not easy to answer it yes or no. It's kind of an explanation question.
Well, does it render them unconscious?
The medications that we give them does, yes.
Okay, thank you. And you have to do that, you have to give them the medication because of the electric shock, correct?
To make them more comfortable, yes.
Well, it knocks you out. It would make you more comfortable, correct?
Yes,
All right. You would agree with me that this is the last type of resort of treatment for depression, correct? Since it's so severe.
yes, it's one of the more invasive, I guess you could say, treatments.
In fact, it's pretty much a safety net, if you will, or a catch-all for the last thing to do before giving up hope. Is that?
We use it for treatment resistant, yes, depression.
Now, you indicated that this ECT therapy would alleviate Ron Coker's depression?
Yes,
You would agree with me that this ECT therapy only provides a benefit for a limited period of time?
yes, he would probably need repeat ECT throughout.
So you need, okay.